A few years ago, the course was structured very differently. We had 4 of these sessions on MSK anatomy, and I was given one of the lectures, and I thought, what am I doing? Why am I talking to pharmacy students about MSK, joints and muscles and things like that? And it turns out it's actually really important. As you see here, as a quote from one of our clinicians at UCSD, 80% of all patient complaints are musculoskeletal in nature. That may be an underestimate, actually. In fact, what I was told was that while if you have a serious problem with like your knee joint, in theory, you're supposed to go see an orthopedist about that. In fact, what happens for a lot of people is they limp into a pharmacy looking for an ice pack and any other information or relief they might get, and they might not have health care, health insurance. They might be looking for some other way other than going to see an orthopedist to treat their problem. So it is reasonable and useful for a pharmacist, and particularly a retail pharmacist. You're guaranteed to encounter patients who come in with frozen shoulder or tennis elbow or carpal tunnel syndrome, or they had a hip fracture, or they've torn their ACL in their knee, or they rolled their ankle laterally and they have a sprained ankle. So it's useful for you to know these basic things about musculoskeletal anatomy. It only has 2 functions. This is pretty simple. Muscles generate force, obviously to move, okay, and also to hold yourself still. So when you're standing upright, it's not like you're not using any muscles. You got to contract muscles to maintain a particular posture. So muscles generate force. They can also generate heat. So shivering thermogenesis, that's muscles that do that. Skeletal muscles, that particular class of muscle, not cardiac, not smooth, skeletal muscles can be controlled voluntarily. That doesn't mean that every time a skeletal muscle contracts that you're willing it. It just means that you can control them voluntarily. So for an example, if I want to kick a soccer ball, boom, I'm going to extend at the knee with my quadriceps muscle, right? But then if a physician comes along, I'm sitting on the edge of the table, right? Physician comes along and taps my patellar tendon with a reflex hammer, and my knee extends involuntarily. That's a reflex. So I didn't do that on purpose, but it's still a skeletal muscle that I can control voluntarily if I want to. Another key example of that is respiratory muscles. We don't think about breathing, thankfully, because I got enough going on in my head without having to remember to breathe. But if I want to, I can stop breathing. Right, it works for, 45 seconds or a minute, and then you pass out, and then your brainstem kicks back in and says, all right, that's enough of that. So skeletal muscles can be controlled voluntarily. The way that works is we have a somatic motor neuron that goes all the way from the central nervous system out to the muscle, okay? And here's a little cartoon that shows that. Imagine the brain and spinal cord over here on the left. There's a little cartoon neuron there. Tim talked last week about the structure of a neuron. There's a cell body. That's the black circle there. And then there's a long, skinny axon extending out toward the periphery. That's the black line, and it ends in a little triangular shape. That would be the synaptic terminal. And so we're arriving at a synapse that this somatic motor neuron is going to make with a skeletal muscle. And the way that a somatic motor neuron or skeletal motor neuron, you can say it either way, stimulates a muscle is it releases a neurotransmitter, and the neurotransmitter is always acetylcholine, always. So basically it's real simple. For skeletal motor neurons, you go from the central nervous system all the way out to your target muscle, you dump acetylcholine on it, and that makes the muscle contract. Or you stop releasing acetylcholine and the muscle relaxes. That's all there is. Okay, I think I've made those points. In addition to this, it is possible for a muscle to contract sort of asynchronously. You get tremor or kind of a little shivering motion if you dump a bunch of epinephrine from the adrenal gland into your bloodstream. And there are little epinephrine sensitive receptors on muscles that then cause them to sort of tremble, basically. And so there is a phenomenon called physiologic tremor that comes from epinephrine. But acetylcholine is our natural single solitary neurotransmitter that stimulates muscle contraction. All right, another point to make about muscles, another basic point, is that they work in antagonistic pairs, or many of them do. So here's an example right here where we're going to be looking at motion at the knee joint. And right here, you see the hamstring muscles, which are located posteriorly at the back of the thigh. What they do at the knee is they flex the knee. Now, we talked about the elbow before. Here's elbow flexion, here's elbow extension. The knee is a lot like the elbow, but spun around backwards. Okay, it's a little tricky. You got to remember that the knee sort of works the other way. So flexion at the knee, I'm going to stand up and demonstrate flexion at the knee here. Oop, move that camera. So actually, at my left knee, I just flex right there. And then I'll flex at the right knee and then extend it like that, right? So that's knee flexion and extension, works the other way compared to the elbow. And the hamstrings, among other muscles, are knee flexors. And then look at this, the quadriceps muscle on the opposite side of the joint up front, when they contract, they're going to extend at the knee. So the hamstrings and the quadriceps muscles are antagonistic. One flexes, the other extends. They can't both do those things at the same time, right? So what happens when you want to flex your knee is the hamstring muscles will contract and the quadriceps has to relax and let it happen, right? And then when you want to extend your knee, say to kick a soccer ball, the quadriceps muscles the quadriceps muscle, it's one, the quadriceps muscle is going to contract and the hamstrings have to not contract. They have to be relaxed and let it happen, right? If they both contract at the same time forcefully, that's going to lock the joint in place and the joint will be fixed in a particular position and it'll be hard to move it out of that position. We have a lot of muscles. It's like 600 or 700 something, I forget. Don't worry, we're not going to learn them all. We're going to learn a few representative examples for a particular group of muscles that perform a particular type of action. We're going to learn one example typically, okay? So just a few for us. We're going to study key groups and one or two representatives from each one.